Hi, I'm Stephanie Nano with the Associated Press. At the beginning you said that you were speaking because of a desire to get the right information out. And obviously at the beginning there was some missteps with the reporting of her death, which I'm proud to say the AP didn't fortunately fall into. But what about, other than the personal, with your parents being pulled into it, what about the news coverage made you cringe when you heard things? Were we getting the details right, or what did the media in reporting on her injury, what made you cringe?
I think the media did a very good job. I've been told by both media, friends, and physicians that this was an example of an excellent interaction. So I can't say that I've seen anything wrong. Obviously, there were examples of running with individual points. For example, I think at one point Dr. Reese suggested that the bullet came from the back to the front. And he wasn't saying that in any definitive kind of way. That was our first impression. At that point, we had no cameras, no police reports, and clearly that was not the right trajectory. And so it is a little frustrating when something is mentioned and all of a sudden it takes a life of its own, and you worry about that coming back to haunt you in the sense that, well, you're called into court, and doctor, you're the one who said it came from back to front, so it couldn't have been this shooter. But no, other than that, and little minor points, I would say everything went about as well as it could, and we did feel as though we were being respected properly. And we felt also that we were being respectful to the media. We wanted that to be an exchange that was reciprocal.
Hi, I'm Judy Stone. I'm an infectious disease physician. So I want to thank you for your great communication as well as your good work and the best communication I've heard and explanations. The best communication from a neurosurgeon, unlike ours in the community, as well as your modesty in stressing the need for multidisciplinary teams. I have one question actually for the press relating to the woman who spoke earlier, and that the coverage that I was disturbed by in this story is there are all these pictures of Congressman Giffords and her husband holding hands, and there are all these pictures of how she looked the day she was shot or how she looks. But I think it does, personally, I think it does a disservice to the public to not show the trauma of what was done, not just to her or other gunshot victims. And it would be nice to see that portrayed realistically rather than just her in the pretty pastel suits. And I don't know if you have any thoughts about...
I do. I understand that would be useful to the public, but I also understand that a picture is worth 1,000 of words, and with those words will come rampant speculation. And I have patients, plenty of whom I operate on, with brain tumors, who right after surgery look like someone punched them in the eye. Essentially, I did. And 3 weeks later, that big swollen eye has turned into a bruise, and their hair is still partly clipped. And then somewhere around 6 months later, they look like they've never had brain surgery. And if I did my job well. And I think it's very important, perhaps the Congresswoman, after all is said and done, after she's recovered as well as she will, may release some of that as sort of a retrospective kind of documentary, and maybe that would be valuable. But going forward, I understand, because if you release one picture, people start speculating what you will or won't do, what you can and can't do. And I think that in some ways can be more destructive.
Yeah, that's a great explanation, and I respect that decision. I wish, though, that the press that's reporting on the gunshot wounds, if not using her as an example, would show some of the horror of gunshot wounds that I see in the hospital as well.
Sure.
Thank you.